Stroke is still the second leading cause of death in this country, and actually up to 80% of strokes can be prevented if people maybe were more aware, were taking better care of themselves. Dr. Dyveke Pratton from St. Thomas is here to talk about this.
Yeah.
Glad to have you in.
Thanks for having me.
But unfortunately, it seems like we've been hearing these numbers for a long time. Why is it still such a leading cause of death?
Well, it's a leading cause of death because stroke is caused by the leading crises in healthcare in America, including obesity, diabetes, high blood pressure. And what we have seen, unfortunately, is an increase in the rates of obesity, especially in young people. So the childhood obesity epidemic is now leading us to seeing people have strokes at younger ages, and thus the rate of stroke, which used to be considered an old person's disease,
Sure.
Is really increasing leaps and bounds.
What exactly happens in a person's body when they're suffering a stroke? And I know there are different types of
Right.
stroke.
Yeah. So there's two major types of stroke, and there's one where there's a loss of blood supply to an area of the brain, and because blood is important for the brain's survival, when you block blood supply, the brain then becomes injured, and eventually those cells in that area die, leading to stroke. And that's the most common type of stroke. The other type of stroke is what we call hemorrhagic or a bleeding stroke, where you have an acute bleed or blood in the brain that leads to the same kind of damage and a stroke as a result.
So what would the immediate symptoms be?
So symptoms can vary, but we really talk a lot, and I know you're going to bring this up later, about sort of the FAST acronym, which we've been using for years and really are trying to get the word out. In either type of stroke, patients can have an acute onset suddenly of facial weakness, weakness of one arm or one leg on the same side, difficulty with speaking. Strokes can have associated confusion, headache, but really we're looking at, do they have a weak face? Are they having trouble speaking, whether it's they can't find the right words or they have slurred speech, or is one side of their body weak in comparison to the other?
If you're alone, what do you do and these symptoms come on?
Well, if you are alone and that happens to you and you're still able to or capable of picking up the phone and dialing 911, that's absolutely what you should do. A lot of our patients sort of say, well, maybe if I wait an hour, it will go away.
Go back to bed, roll over.
Right,
Don't
and
do
we
that.
hear that so many times, and I think the advancements in stroke medicine really need to shift patients coming earlier, because there are acute treatments that we can give patients to reverse the stroke. So we're really trying to educate people. If you see somebody that's having symptoms like that, or you yourself or a loved one, family member, somebody on the street, you should be calling 911. You shouldn't be waiting an hour to see if it goes away. And certainly don't get in your car and drive. Just have the ambulance come pick you up.
Because the time is brain power, right?
Time is brain.
Time is brain.
Yeah.
You can save some of that brain tissue.
Absolutely.
Whatever. Okay. Now, what are some of the risk factors? You've mentioned obesity, but what are some of the other risk factors we need to know about?
Yeah, so diabetes, high blood pressure, obesity, those all run in hand, and those are really the most common risk factors. Another one we talk about a lot is smoking. Unfortunately, even though the rates of smoking have decreased, there's still a lot of people out there that smoke, and that causes blood vessel damage. People who have cardiac issues, atrial fibrillation is one of the most common cardiac arrhythmias that leads to people having stroke. Family history, obviously.
Yes.
That's not necessarily a modifiable risk factor, but certainly can be.
Okay, also I see here excessive, can you pull that screen up again with the list? Thank you. The excessive alcohol intake.
Yeah.
So how often is that related? Do you have stats on that?
I mean, I think alcohol in and of itself, people who have alcoholism, they are at risk for a couple of different things. First of all, often nutritional status is not really all that great in people who consume large quantities of alcohol. I think that alcohol can be associated with exacerbation of blood pressure issues and diabetes. And then in addition, people who do abuse alcohol, their brain tissues can become a bit more friable. So they can have bleeds, they can fall down, leading to bleeds.
Sure.
So alcohol in and of itself, in moderate and low quantities, we don't consider that to be a major risk, but obviously consumption of anything in excess is dangerous.
So let's go over some of the treatment modalities then. Of course, if you get to the emergency room fast enough, are they giving you, is it TPA?
Yes, that's correct.
And explain what that is.
So TPA is a clot buster. So that's what it does. If you come into the emergency room and you have signs of a stroke, the neurologist or emergency room physician will make an assessment as to, what they think is going on, and you'll get a head scan to make sure you don't have bleeding, because obviously we don't want to give a powerful blood thinning agent to somebody that has blood. And within a 4.5-hour window, we can provide this medication TPA. And it's meant to break up the clot, because we think there's a blood clot sitting up there that's leading the symptoms of stroke. And if you can dissolve that, then you open up that vessel and provide opportunity for the brain to get blood supply again.
Okay. What are the chances of having another stroke if you've had one, of another one occurring?
So high. I mean, I think that one of the risk factors of having another stroke is having one stroke. And we see that if people do not modify their risk factors, or they don't really take into consideration all of the things that we've discussed, and we see that, unfortunately. I think it's easy to say change your diet, take your blood pressure medications, but life is difficult, and I think sometimes people want to do the right thing but just can't. And there are resources available for people. There's the National Stroke Association, there's the American Stroke Association, St. Thomas has a stroke program, and certainly education is available for patients who need help.
Thank you so much,
Thank
Dr.
you.
Pratt. I
Thank
really
you for having
appreciate
me.
it. As always, thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.